Hi, I'm Lauri Kane, and I'm here with my plastic surgeon husband, Dr. Dean Kane, in our Center for Cosmetic Surgery and MEDI-SPA, and I'm about to undergo a Sculptra treatment for stimulating collagen elastin. It's injections under my skin, as well as a controlled depth chemical peel for skin tightening. I am doing it under IV sedation this morning because the combination is a little overwhelming to do them together, so I opted to have a super pleasant experience. I'll come out of the OR in about an hour and a half. I'll be in no pain, and I will have a pretty easy recovery, 7-day, fairly easy recovery. Then I'm going to have you follow me over my 7-day journey. And the next step that's going to happen is that Dean is going to start marking my face in terms of where he's going to be putting the Sculptra. And since I was under this morning, I opted to add other places for my Sculptra. So I'm actually doing my face, my neck, my décolleté or my cleavage, and actually the crepey skin on my legs. So it'll be a nice Sculptra day this morning for Dean.
That's what we're doing today.
All right, so he's going to start marking my face and doing his thing.
So Lauri's got some very specific areas that she wishes to stimulate, primarily around the eyes, okay, and around the mouth. So Sculptra is going to be concentrated in those areas, and then we're going to break and go to the neck, the décolleté, and to the thighs. As our office staff is massaging the Sculptra into the skin in the various areas, then I will come back and perform Dr. Obagi's well-known blue controlled depth peel. The reason for doing that is this way we can get the fibroblasts to be stimulated underneath the skin to form collagen, and instead of the collagen unraveling like it does with aging, it stimulates new collagen to actually tighten and firm up and thicken the skin. From the top layer, the controlled depth peel, which is blue in color, will allow me to see the depth of the injury to the skin. And that will further stimulate collagen formation through the skin, as well as exfoliation of the skin. And so the two combined procedures are there for being used. There's a lot of intensity when you're using the injections or the chemical peel, but Lauri's going to be very happily asleep with IV sedation during that.
And the goal is that I'm going to really get, even though I had a facelift, my face continued to age, and the goal is to stop and control that aging process, and we're doing that with Sculptra under the skin and the controlled depth on top of the skin, so the combined under and over will give me an incredibly wonderful facelift like tightening.